Well, over the course of the pandemic, Deaconess Health System cared for nearly 3,000 tri-state patients with COVID-19. And now the hospitals are planning to bring those patients and their families back together with their caregivers and providers. Reunion events are planned for Sunday, July 25th. Joining me now is Dr. James Porter, president of Deaconess Health System. Dr. Porter, tell us about these COVID-19 survivor family and staff reunions. Why is it important to hold these?
You know, Shelley, it all started with just rounding on our employees here at Deaconess and hearing from them how interested they were in hearing what may have happened to the patients and families that they developed these really deep relationships with during the height of the COVID pandemic. And it just sparked the idea of, when it got safe enough and there was a way that we could do it, in a safe and healthy manner, how could we get folks together to be able to allow some of those reunions?
Well, I know COVID was so difficult for patients and families because the hospitals were closed to visitors and the staff really stood in as surrogate family. And that creates a special bond. I mean, there always seems to be a bond between a patient and a doctor, or a nurse or any healthcare provider, but this is different this time around. What will this kind of reunion mean for families as well as staff?
Yeah, you're so right. It's going to be meaningful, I think in ways that we've really never experienced before in healthcare. As you said, so often, unfortunately, we weren't able to allow visitors, and so our staff really stood in for families and became their surrogates at the bedside, sometimes in very difficult situations. And so there are relationships both with family members who were at home and concerned about their loved ones who were in the hospital, and also relationships with those patients, where our nurses and techs and many others often sat at their bedside with them or helped them connect via Zoom or their iPad with some loved ones. So lots of great relationships that it'll be fun for people to be able to rekindle.
That's right, and we've even heard stories. We've interviewed some nurses who actually, sat with those patients, held their hands even to the very last moment, and that has to be emotional, and it has to be something that carries with both sides for so long. And the families may not have met these folks. Can you imagine what some of this reunion is going to be like?
Yeah, and that's one of the reasons when we were trying to figure out how we could do it safely, we felt like there's just going to be no way for us to maintain social distancing at a type of reunion like this. So we really decided the only safe way to do it was to make sure that everyone's immunized who's going to participate in it. We knew that there'll be hugs and there'll be tears, and it'll be tears of joy, I think, and in some cases tears of sorrow. But in any way, we believe and hope that it will be a real opportunity for healing on both sides.
And you're talking about safety. People need to be immunized. It's also going to be held outside, as I understand, as well. Is this kind of an indication that the pandemic is over? Is this perhaps too soon to do something like this?
I wish I could say the pandemic is over. It definitely isn't. I don't think it's too soon to do something like this because we have really good evidence now that people who are fully immunized are at very low risk of contracting or spreading the infection and are even at lower risk of getting seriously ill. So we feel like with the advent of the vaccines and now them being so readily available, it's very safe for us to do this. However, the pandemic isn't over, and we want to emphasize to people the importance of, if you aren't vaccinated for whatever reason, you aren't able to be, for some reason you're choosing not to be, it's still important to wear your mask and maintain social distancing. We just don't think it would be very feasible for us to try to use that approach for this gathering.
I want to take a couple of seconds here to ask about a couple of things related to that. We've been hearing a lot about the Delta variant these past few days. And although COVID numbers are declining, experts are saying that this Delta variant that hit in the UK and in India is hitting young people 12 to 22 years old particularly hard. Have we seen this Delta variant here in Evansville and the surrounding area?
No, we've seen a number of the variants. And so the most common types of COVID-19 or SARS-CoV-2 in circulation right now are not what we call the wild type virus, which was the original one in circulation. They are variants. However, the Delta variant at this point has not been one of them.
Are you concerned about it eventually making its way here, and what's the best way to prevent getting it?
Yeah, we have to be concerned these days, given how mobile people are and how there's international travel on a regular basis, and much of that has been loosened. The restrictions on global travel are being loosened. So we do need to be concerned about it. And I think, Shelley, it highlights the importance of why it is so urgent that we get as many people vaccinated as possible. That's really what's going to prevent the kind of person-to-person spread that could cause us to potentially have some kind of resurgence here in the United States. So, all those folks who aren't immunized right now are benefiting, frankly, from the fact that people who are immunized aren't spreading person-to-person. We just need to get that to as close to being everyone as we possibly can.
I heard just yesterday that Indiana is only at about 45% of the population vaccinated. I'm also hearing from folks that there's still some folks that are holding out there because they're hearing things, rumors. One of the biggest ones is fertility, that the vaccine affects fertility, particularly in women. And we're also hearing about young men having perhaps some heart complications from the vaccine. Can you address both of those issues, please?
Yeah, there's, first of all, with the fertility, there's just no evidence whatsoever that these vaccines in any way affect a woman's fertility. We believe that those rumors came from some anti-vaxxers who had some kind of far-fetched connections that they tried to make through certain types of tissue and the virus. And it just really has no foundation whatsoever. And millions of women have been vaccinated with no evidence of that. The other issue with regard to some myocarditis, if that is a case with the vaccine, it is exceedingly rare. And it's much more rare than the number of folks who are having those types of complications with the infection. So still much safer and much smarter to get the vaccine in order to prevent the risk of myocarditis that comes along with the infection than the extremely low, if at all, risk that there is associated with some of the vaccines.
All right, Dr. James Porter from Deaconess Health System, thank you so much for taking the time today, talking to us about this reunion and other things related to COVID-19. We appreciate your time today.
Thank you, Shelley.
Now, there will be 2 reunion events on July 25th. Now, this depends on where the patients were hospitalized. Patients who were hospitalized at Deaconess Midtown or Gateway hospitals are invited to Bosse Field in Evansville, that's inside Garvin Park, from 1 to 3 p.m. Those who were hospitalized at Deaconess Henderson Hospital will meet with staff in the hospital's lower parking lot from 4 to 5 p.m. Now, you must register for this event, and you can find a link at our website, tristatehomepage.com.